Thanks for tuning in on today's segment where we're going to be talking about turmeric, Curcuma longa. Turmeric's been having a bit of a golden moment recently. Turmeric containing golden milk lattes have been taking over artisanal cafes near you. And in just a couple minutes, you're going to walk away from this video understanding what the hype is about turmeric and why you should care. If not, your next golden milk latte is on me. So in this video, we're going to explore the world medicine perspective on turmeric, and then we're going to dive into the latest research, exploring its wide array of medicinal benefits, ranging from how it acts as a strong anti-inflammatory for conditions like arthritis, all the way into its antioxidant advantage against cancer cells, particularly those in the colon. So without further ado, let's get started. And so here is the turmeric plant. It grows to be about 3 to 5 feet tall, and it's cultivated significantly in India, China, Iran, and most of Southeast Asia, along with some other locations with tropical climates. It has this gorgeous central white and pink flower, but the part that we use as a spice and as a medicine is the rhizome. The rhizome is a root-like stem that grows horizontally underground, and in that rhizome is the organic compound called curcumin. Curcumin is the compound that gives turmeric its vibrant orange color, and it's going to be an important point of our focus today. In 500 BCE, turmeric emerged as an important medicinal herb in Ayurvedic medicine, which is the ancient Indian system of natural healing. In Ayurvedic medicine, it helps with indigestion, infection, and inflammation, the 3 I's. External application is used with honey and it would help with sprains and bruises. So in Ayurvedic literature, there's over 100 different terms for turmeric. A couple that I like. One is called Jayanti, which translates to the one who is victorious over disease. Another one is Matrimanika, which translates to as beautiful as moonlight. You don't get those kind of nicknames from being unremarkable. So turmeric possesses both heating and drying qualities. If you've ever taken a finger to turmeric, you will feel both those things to be true. Your mouth kind of just gets dry, less saliva, and it also gets really warm. But I also think that in order to understand an herb fully or a plant fully, it's important to learn from the cultures of people who have been using it for thousands of years. It's a little bit egotistical to think that if you run one research trial or one experiment that suddenly you have more knowledge than that which comes from lineages of people who have been using it for medicine as centuries and literally evolving with it. So, okay, coming back to turmeric, in order to really understand this herb and this plant, we have to understand it in an Ayurvedic context, which is the system of medicine in which it evolved with. There's 2 concepts in Ayurvedic medicine that we need to understand first. The first one is Agni, which translates to digestive fire. We can think of that fire as the energy needed by our body for digestion and metabolic processes to occur effectively. The second concept is Ama. Ama is the concept of all of the toxins that accumulate in our body at any given time that hinder and cause problems for our digestive and metabolic processes. Okay? So it's Agni and Ama. Now, turmeric is known as the Dipana, that which kindles the digestive fire, that which kindles the Agni, improving digestion by improving blood flow. Turmeric is also anti-inflammatory and it's also antibacterial. So alongside improving blood flow, it's also helping to clear toxins from the system, the Ama. So with that said, let's explore some of the modern research. So let's talk about the research. Number 1, turmeric and knee osteoarthritis. Turmeric extracts have been demonstrated to be effective in the use of knee osteoarthritis by reducing knee pain and improving knee physical function. And the results were similar and comparable to that of NSAIDs. So think ibuprofen. except they have fewer side effects, suggesting that turmeric could be a good alternative to patients who have knee osteoarthritis who are looking to manage their pain, but who can't and don't want to take NSAIDs. Turmeric is a natural anti-inflammatory. That's how this is happening. And it's a natural anti-inflammatory by its ability to inhibit our COX-2 enzyme, which is an enzyme in our body that's responsible for producing pain, inflammation, and also spiking a fever. Next, let's talk about asthma, which is a chronic airway inflammation disorder. So, bringing in the anti-inflammatory properties that we just talked about, curcumin as an add-on therapy to the treatment of bronchial asthma has been demonstrated to improve lung function and reduce airway blockage to the lungs. Next up, turmeric and its ability to help with blood sugar control, which is really important for our type 2 diabetics in the house. Turmeric can help lower blood sugars, our fasting blood sugar specifically, and improve insulin sensitivity. And how does it do this? This is because turmeric is able to upregulate our genetic expression of glucose transporters on our cell plasma membrane, meaning that it can help shuttle more glucose from our blood into our fat cells and our skeletal muscle cells specifically. So it reduces the burden of insulin acting like a sheepdog, like a cattle dog, trying to promote more glucose coming into our cells. And that's how it helps improve insulin sensitivity. Next up, because of those same metabolic effects, turmeric has been shown to be helpful with patients with polycystic ovary syndrome by improving fasting glucose, by improving insulin sensitivity, and also helps reduce weight. And you better believe turmeric is helpful for protecting brain health. Turmeric reduces inflammation in the brain, making it a neuroprotective, a neurocognitive, and there's promising research for turmeric in patients with Alzheimer's and Parkinson's disease. Why is this? Well, in order to understand that, you got to know that we have a cell in our brain and in our spinal cord called a microglia cell. The microglia cell acts as this first responder. It's making sure our neuron health is good. It's making sure the connection between the neurons is good through our synapses. It's reducing inflammation. It's fighting off infection. And in conditions like Parkinson's and Alzheimer's, those microglia cells are not acting right. And they're wreaking havoc, and they're not doing exactly what they should be. And curcumin is able to properly regulate microglia cells. And therefore now there's promising research that curcumin can be used in conditions like Alzheimer's and Parkinson's disorder. So we covered the bones, the metabolism, the brain. What about our heart? Turmeric has been shown to reduce the risk of heart disease. It does this by improving our blood sugar levels, lowering our cholesterol, triglyceride, and reducing inflammation and lowering blood pressure, specifically systolic blood pressure. Liver? Turmeric or curcumin extracts have been shown to reduce the severity of non-alcoholic fatty liver disease. And this is seen through reduction of our liver enzymes on lab results, our AST and our ALT, our liver enzymes. And also we see a reduction of the fatty deposits in the liver through ultrasound imaging. And last but certainly not least, turmeric and its effect on colon cancer. A comprehensive systematic review demonstrated how curcumin reduced the side effects of chemotherapy and radiotherapy, thus improving patients' quality of life. Several studies also demonstrated that curcumin extends patient survival and lowers tumor marker levels. The mechanism of action of curcumin's impact here is because it can specifically target colon cancer cells through targeted cell death, apoptosis, while sparing normal colon cells. And lastly on this note, curcumin has been proven to be a powerful chemopreventative, meaning an agent used to reduce the risk of cancer occurring in the first place. And that's attributed to its powerful action as an antioxidant. So, a couple points to end on here. Curcuma is fat soluble. So if you're cooking with it and you'd like to extract more of its medicine in the cooking, make sure you cook with the fat. So that could include a milk, coconut milk, or regular dairy milk, butter, ghee, you name it. Second point, adding in black pepper helps increase our body's ability to digest the turmeric and the curcumin and absorb more of it. So, even after all of that research, somehow I come back to viewing turmeric as matrimonica, as beautiful as moonlight. And I hope this video illuminated the power turmeric has, both in its ancient use and in the modern research we have to demonstrate a lot of its medicinal potential. And even if it's just taking a note, when the next time you have curry, like, wow, this is what gives my curry this color. Or it's making a fire cider with turmeric. You can watch one of my videos I made about that. Or if you have any of the conditions talked about above and you want to work with the naturopathic physician to see how turmeric could be relevant in your life. Or none of them and you just want to play and have turmeric in your life, you can add turmeric to a fall harvest soup. A bunch of different seasonal squashes. I think in knowing the power of these herbs and of these plants, somehow we can make space for them in our lives in really creative ways. If only we knew why we should and why we should care. Thanks for tuning in today, and I hope to see you next time. Bye.